right, welcome back everyone to Public Information During a Pandemic session with Jeremy Zidek, the State Public Information Officer with the Alaska Division of Homeland Security and Emergency Management, and Elizabeth Manning, the Public Affairs and Public Information Officer with the Alaska Department of Health and Social Services. Jeremy, Elizabeth.
Hi, well, good morning. Thank you for joining us. Just a little bit about myself. I'm an Anchorage kid. I went to kindergarten at Wonder Park, high school at Service High, and college at UAA. So I've just lived my life right here in Anchorage, Alaska. I've been with DHS and EM for about 13 years now. Really the first big disaster that I worked there was the 2009 spring floods when Eagle, Alaska, and some other places got flooded out pretty bad. And 2013, the floods along the Yukon and Kuskokwim River were another big event that we worked. And through the years, we've worked floods and wildfires and sea storms and whole range of other type of events. And I would say the two biggest events that have come my way have been the 2018 Cook Inlet earthquake and the COVID-19 pandemic. Both of them had some significant challenges, and glad to talk about the COVID-19 pandemic today with Elizabeth. Elizabeth?
Okay, searching for the unmute button. Isn't it the story of our life these days? A friend of mine said that she's gonna make us all mugs that says, "You're on mute," at the end of all this. So welcome. Thank you very much for having me here today. And my name is Elizabeth Manning. I'm the DHSS Communications Manager, and it's been a real privilege to be part of Unified Command and to work alongside Jeremy now for well over a year. So my background real quick is I've been at DHSS as communications manager for maybe about 1.5 years. And before that, I was the public information officer assigned to the Division of Public Health. And prior to that, I worked at the Alaska Department of Fish and Game doing education and outreach for about 12 years. And when I first moved to Alaska in 1998 to work as a reporter for the Anchorage Daily News. So my background is in journalism and had spent quite a few years doing that before I came up to Alaska. Thank you.
All right, so our presentation today, COVID-19 has really touched all facets of our life. Before our presentation, we're going to focus on these 5 different areas: the arrival of the pandemic, health mandates, testing, medical capacity, travel restrictions, and vaccine distribution. And for each of our slides, we're going to give some dates that were significant, and hopefully that will jar your memory and take you back to that time. And then we're going to talk about some of the communications challenges that we faced dealing with these different facets of the pandemic, and talk about some of the messaging and tactics that we used as public information officers.
Okay, so looking back, we really were able to prepare early on for this pandemic, both in terms of from an operations standpoint and a communication standpoint. And many of you are, I'm sure most everyone in the room is well aware that we kind of got an early start into this pandemic with the Wuhan repatriation flight that landed to refuel in Anchorage on January 28th. So this was the first repatriation flight and the only one to land in Anchorage. But after that, there were quite a few flights like this, and there was a large repatriation effort that took place, bringing citizens out of Wuhan, China, back into the United States. So we didn't have a whole lot of time. We heard the DHSS leadership heard that the plane would be landing, and I think, looking back, we had maybe about a week lead time to prepare everything and be ready. And one of the things, we were already starting to do this right before we heard about the plane landing, but we were starting to hear a lot of news globally about the virus in Wuhan, and starting to get inklings from public health experts that, you know, this had potential to spread across the globe and to become the next pandemic. So we had fortunately, not too many months before, I believe it was in April, we had been part of a big public health exercise called Raging Contagion. And during that exercise, we had involved a lot of the public information officers all across the state and had started to build bridges. And that exercise was a huge amount of work. It took, you know, many weeks to lead up to and at least a week to go through. But I am just so grateful for that now, looking back, because we had already built up a public information network and had started working together because of that exercise. So when the pandemic hit, we began to gather together again. And one of the first things we did was start up some regular communications calls with community PIOs around the state. And then as it shows on the slide, the Unified Command was activated March 16th. So, you know, we had an early start with the Wuhan landing, and then, you know, lots of regular calls with community PIOs, regular press briefings early on from the Wuhan flight. And we just got used to this being a continually evolving situation with just rapidly changing information and kind of having to and pivot every day. And I just wanted to tell one quick story about the Wuhan landing, and that was that you know, we probably had 4 different press releases prepared, because we didn't know exactly what was going to happen when the plane landed, whether they were going to carry on to California and all the health screenings were going to be fine, or whether they were going to stay a little bit in Alaska. And I remember having somebody with the CDC say that they were going to quarantine the folks the plane passengers when they landed in California. And I had that in the press release, and Dr. McLaughlin, our state epidemiologist, was really questioning me on that. And he said, you know, I don't think we can say that. So we ended up changing it to, you know, staying for an indeterminate amount of time. And it turned out later that they were quarantined, and it was the first time in 50 years that the quarantine laws had been used. At least that's my recollection of it. So it was really, you know, just kind of a wake-up call early on that we were going to be part of a really big deal and part of history. Okay, thanks, Jeremy. Anything more?
So our health mandates, and you know, these have evolved throughout time. The mandates were changed several times based on guidance that we received from CDC, or changes that we decided to make at the state level. So the mandates weren't something that were static. They changed quite frequently. Between March 13th and the 27th, we saw 12 different mandates be issued. We also had health alerts coming out in that time frame. And so in this 14-day period, we saw drastic changes to how we conduct our lives here in Alaska. And, you know, the governor, Commissioner Crum, and Dr. Zink and the medical community were really doing their best to develop these policies as quickly as they could to stop the spread of COVID around the state. And as PIOs, we didn't always get a sneak peek at this information before it was being released to the public. And that was being done at the 5 o'clock press conferences. And so that really kind of put us in a situation where we were scrambling to provide background information, to provide resources to people, to develop graphics like the ones that you see at the bottom of the screen. And so that was a really big challenge for us throughout the event. I'm not being critical of the way that they were rolled out, because I think that these were really necessary mandates to be put in place. And I'd like to just kind of make the analogy, as soon as the cake was done, it was being served. And there wasn't any time to put icing on the cake. They were just getting the mandates out as quickly as possible to stop the spread, because that's what was key. This led to a lot of questions that people turned to the PIOs to answer, and we were doing our best to try to answer those. I think one of the keys was that we set up one website where people could go for information, and where we were taking all of our information and putting it onto that one website. And then also the Department of Health and Social Services had someone developing some FAQs for the response. And that really became the common talking points that we would use to respond to questions. And that was just absolutely critical that we got those questions answered. So the mandates did reduce a lot of travel in the state, reduced contact amongst people, and that was the main purpose. But people didn't like that. They didn't want to stay home, and so on and so forth. So we were constantly trying to message about the importance of the social distancing measures. Another big thing that we were talking about was the Small Business Administration PPP loans, the unemployment benefits, and the stimulus benefits that were coming out, and trying to provide people with information about how they could take advantage of those programs. This was really done in collaboration with a lot of partners, like DCCED, that you wouldn't really normally associate with a health emergency, or the folks that manage unemployment. And so it was really a large collaborative effort. And then a big question throughout, and we're going to hit upon this a little bit more later, is the enforcement. Who is enforcing? When is it enforcing? When are we enforcing? What options local governments had? And, you know, we throughout the event really focused on voluntary compliance and asking Alaskans to comply. Elizabeth?
Yeah, I don't really have anything to add. Just hats off to Laura Russell at DHSS, who was the one managing that those FAQs for quite a long time, and just, you know, with a team as well of experts answering them. Marmion has a question in the chat box. I don't know if you want to take that now, Jeremy, or
let's take them at the end.
Okay, thank you. Yeah, thanks, Jeremy. I'll move on to the next slide then. Okay.
But continue to put questions in the chat box, and we'll get to them all at the end of the presentation.
Oh yeah, and that reminds me too, we didn't set up any kind of quiz or anything like that, but we thought it would be fun if folks put in the chat box some piece of advice that they remember hearing or giving if they were a PIO at kind of the beginning of the response that changed towards the end, you know, something that we were saying at the beginning, and that advice, you know, evolved over time. So I think that would be fun to put those in the chat box. The next thing, you know, and as Jeremy said, you know, there's just so much we could talk about. Communications has been such a large part of the COVID-19 response, and it's going to be dissected, I'm sure, by the experts for many years to come. But we wanted today to just focus on a few of the specific responses and the information issues surrounding those responses. And so one of them was testing and medical capacity. So Back to that Wuhan flight, when those passengers landed, we didn't even have widespread testing in Alaska. So there was no testing of those passengers. They were screened with temperature checks, and they were tested when they got to California, but there was no widespread testing. Testing was really limited in the beginning, and there was a much greater demand than capacity. And so information wise, from DHSS, one of the ways that we handled that was the section of epidemiology had testing guidance that it offered to providers, and that was updated on a regular basis. So that definitely changed over time to being really limited. We weren't sure whether we were going to continue to be able to get the supplies we needed for testing. But over time, we built that airplane, as Dr. Zink and lots of other people like to say. And we've got a little bit of a timeline in here. The Wuhan flight was January 28th, departed January 29th. We had the ability to test in Alaska. I remember writing that press release with the labs announcing that capacity on February 28th. And then Lake Otis opened on the 16th. The ferries started doing screening. This is not all of the dates, but Southeast Alaska Regional Health Consortium began offering curbside testing. I believe that was one of the earliest, but it may not have been the earliest. And then ANMC opened up their testing site a few days later. And then, communities throughout Alaska started scaling up testing and also working on their surge capacity. And I'm going to let Jeremy talk a little bit about the mass care and surge capacity. He's a little bit better informed than I am on that. So, and in terms of information, though, with testing, it was a challenge to, message this changing information about who could get tested and when. First it was just those who were symptomatic, and even, we were in the very beginning, I remember telling people, that they should just stay home and ride it out because we didn't have a lot of testing capacity. And then eventually it did become more widely available, and even ANMC early on, there was a little bit of asynchronicity there. They were offering asymptomatic testing well before the rest of the state was. So I remember talking to Shirley Young, the PIO there, and just making sure that, it was understandable that some people were doing things a little bit differently and that was okay with everybody. But it just, made it a little bit challenging that there was diversity, but that's kind of been a thread throughout this response, is that, this is a little bit different in each community, and it's very community led. So, okay, with that, Jeremy, go ahead and talk a little bit about the surge capacity.
Yeah, our mass care capacity was really increased to deal with additional COVID-19 patients. Dr. Zink said this morning that there was a moment there where it was close and oxygen was limited in the state. Initially, we restricted a lot of movement and we're really asking people to not move around at all, not go out, send one person into the store. And then some of those restrictions were loosened a little bit as our mass care capacity was scaled up. And this was done in a couple different ways. Hospitals would reconfigure their facilities in order to care for more COVID-19 patients, or they were setting up these alternate care sites. Here in Anchorage, the Alaska Airlines Center became an alternate care site. But, it wasn't necessarily that COVID patients would be cared for at that alternate care site. It could be an overflow for the hospital's normal patients or people that were not infected with COVID. Could be treated in that alternate care site, and then the more seriously injured more seriously ill COVID patients could be treated in the hospital. So explaining that, We had a real clamor from the media to get into these locations and see what was going on there. And so facilitating those types of activities as well was a big part of our efforts.
Okay, great. Thank you, Jeremy.
Oh, and one more thing on that slide, maybe we can, there's comprehensive data available. And what we're talking about here is the COVID dashboard, and how once we started being able to populate that information, that was really beneficial for people to understand what was going on, understand what the state's healthcare capacity was, and that was a really useful tool for us.
Yeah, and just on that, I do remember the testing map going up, and people being asked to add their testing sites, and it's kind of cool to think back now on how we started out pretty bare bones, and then the dashboard grew and grew, and now it's in the different tiled dashboards with lots of different. It seemed like every month or so we were adding a new facet to the dashboard, which is also came with its messaging challenges as well. A lot of people, it was great to see more data become available, but it was also a challenge to let people know how to use the data and to inform them about the changes as they happened. Okay.
Yeah, I think we were constantly telling people, here's the reported data, and this is how it was gathered and when it was posted. And that was a constant messaging challenge. So for our travel restrictions, we had the interstate and international travel mandates, and then the intrastate travel requirements. Alaska and Hawaii were two states that were able to put travel restrictions on, screen passengers coming into the state. The lower 48, their borders between states are much more porous. But here in Alaska, we have 10 or so points of entry by air, and a few by road, and a few maritime points of entry. And so we were really able to set up screening stations and screening processes at those locations. And it made Alaska kind of unique. Initially, travel was severely limited all across the United States, and basically very few people were traveling. Here in Alaska, we made a lot of efforts to get workers back to work. The oil industry is our key economic driver, and in many small communities throughout Alaska, the fishing industry is their economic lifeblood. And so there was a real concerted effort to work with the industries to establish plans and procedures so those industries could operate safely. And then the big challenge for us as communicators was to inform the travelers and the public about what was being required, the infrastructure travelers and the public about what was being required and what safety precautions were being put in place to prevent COVID being spread by critical infrastructure workers, and those critical infrastructure workers bringing COVID-19 into the communities. And that was a tremendous effort that we had to undertake. Another big challenge for us was community-based restrictions. Communities were trying to do things like close down roads to their communities. Well, those roads are state roads, and a community doesn't have the authority to shut down a state road, and they can't prevent someone from traveling on a state road to their private property. There's other restrictions that they can put in place. But we had to work with communities. Most of the time, these issues were just really solved with some conversations, but we did have to explain the process and what the authorities were to the media on a regular basis. A good example of this is communities would not want people traveling, outsiders coming into their community, but darn it, fishing season was taking place and people wanted to load their family into the truck and take the boat down to the port and launch their boat and go out for 2 days. And we had to navigate a lot of these different issues. In addition, during holidays that were taking place, we saw spikes of COVID after almost all the holidays. And we were putting together holiday specific messaging to say, as you're going to go out and do your barbecue, take these precautions. Uncle Sam wants you to prevent the spread of COVID this 4th of July, and messaging along those lines. Again, the travel restrictions, while there were penalties in place, we really focused on the education piece of it and trying to let people know what was required of them and why it was required, instead of trying to impose some type of fine and penalty. And then finally, the airport testing became available, and we were requiring all travelers that enter the state to fill out a travel declaration and to take a COVID test before they travel to the state and provide proof of a negative test result. At first, when we implemented this, we just had paper forms that people would have to go to a website and download. And that evolved into the travel portal, where people could not only fill out the travel declaration, but also upload their negative COVID test. And this was a big challenge because we had to notify people not only within the state, but out-of-state travelers of what was going to be required for them when they arrived in the state. We worked with the travel industry pretty extensively. We tried to work with airlines, but they were a little bit more difficult to get on board. Their challenge is that, well, for example, Alaska Airlines flies to more than 100 airports in the world. And each of those local jurisdictions might have different requirements. And it's just really an impossible task for the airlines to say, when you're flying to this community, you have to abide by this, especially since those requirements may change. During the COVID, things changed on a daily basis in some cases. So we work really hard with the travel industry to get that message out to both providers of travel and services that travelers used, to make them aware of what the requirements were. Anything else, Elizabeth, on this one?
No, I just thought I'd share a quick, just personal story about just remembering how fast the whole airport testing process got scaled up. I mean, it really was phenomenal to see how quickly that whole process was put together. And it was really, probably many of you who are tuned in on the call who were involved with that remember how nerve-wracking it was to remember that first day of travelers and that first day of testing, to see how it was going to go. And I remember talking a lot to Marilyn Romano at the Alaska Airlines, and even what Jeremy was alluding to of, not being able to put materials on the plane. Remember when we used to talk about fomite transmission, or, the fact that the virus could be on some surface and then transmit into the eyes, nose, or mouth. So that was one reason why they didn't want to have anything paper on the airplanes at first. So, just interesting looking back on all that. And then, throughout this pandemic, it's been, as communicators, we want to be storytellers, and we want to connect with people who are going through things and share those stories out, because they're such a powerful way to communicate. But I'm sure we've all experienced how difficult that is, because we've all been, haven't had as much social interaction as we normally can because of the pandemic. But I do remember going down to the airport that first day to just kind of check it out and see how things were going, and get some photographs and get some stories of people. And talking to a few of those people, I just remember how grateful they were that we were providing the testing. And I remember one person in particular who had just been holed up in his apartment in, I think it was Boston or somewhere in the Northeast, and he was kind of depressed. And he really loved wildlife photography, and he was going to go down to Homer and hole up in his hotel and work until his quarantine period was over. And then he was going to go out and photograph otters. And I just think that was it's a cool story to think about the people behind all this as well. Okay, that's all I wanted to share.
We really have to take our hats off to the folks that organized that airport thing, the airport screening and the testing, because, going through the airport, the screening and the testing is only a little bit more cumbersome than the TSA process that we have to go through to get into the airport, get onto the plane. So if that operation hadn't been as smooth, I feel like we would have had a lot more public information explaining to do. That's all.
Okay, thanks, Jeremy. And I have a date wrong on this slide. I just realized I've got to fix that. But so we're now in this, current chapter that we're in with vaccinations and communication around the vaccine. And it feels like we've been in it forever. But it's good to remind ourselves that, the authorization of the first Pfizer vaccine just occurred on December 11th. So it's a chapter that hasn't been going on that long, but it's been fast and furious like everything else with the pandemic response. So the first shipments arrived in Alaska on the 14th, and I think that should say December 15th. The first COVID-19 vaccine was given at EMC. I'll have to double check that. And then the first adverse reaction was the 16th at Bartlett. If I'm correct on that slide, I need to double check that too. But it happened right away, and it was I feel very proud of that response on behalf of Unified Command and a collective effort. Because we've been working so closely together. We were able to call Bartlett Hospital right away and get a press conference set up for, I should have looked up the time, but I think it was as early as 10 a.m. that morning. It was pretty quick. It all came together really quickly. And a lot of folks came on that call. I mean, I think the reactions were happening the day before, and then there had been a national story that came out about it, and we quickly pulled together. And this was the first adverse reaction in the nation to be documented in that way. So it got a lot of national and international attention, and it was great. There was great information from the experts at that press conference, and I think it really, that open exchange of information and transparency really set the stage. And I know this has been a difficult thing, and we're dealing with vaccine confidence, but from the get-go, we've really worked to be as transparent and open and forthcoming with as much information as we possibly can. I wanted to just note that a really cool thing that happened with the vaccine communication and the whole rollout is that there was a joint structure within the Alaska's vaccine task force that was co-led by ANTHC and DHSS. And as Jeremy noted, I mean, this has been a challenge. I've never worked on anything quite so complicated with so many people, so many entities, so many organizations. You know, and it was a little bit challenging for me personally at first to be sort of have this unified command structure and the DHSS structure, and then to have a whole parallel structure with the vaccine task force alongside that. And at the time, I remember, you know, expressing to leadership that we wanted to make sure that things weren't going to be siloed. But now I'm so grateful that they had the, you know, the foresight to set it up that way, because it just would have absolutely become overwhelming, even from a communication standpoint, for the unified command group that was working to handle all of the COVID messaging plus the vaccine messaging. So, you know, it folded more people in, and, you know, every step of the way we've just had to grow and adapt, and it feels like it, you know, changes every week or every month. You know, there's who we're working with, and trying to, you know, set up new ways to communicate both internally and externally. But it was really a strong thing that happened in my mind. So lots of challenges with vaccine communication that continue. In the beginning, you know, we were just really trying to let the public know about who could get vaccinated and where, and that phase lasted for a while. But we were always thinking that each phase would last a little longer from the communications end, and then, you know, all of a sudden we were having to pivot and message to the next group. And then, of course, most of you know that on March 9th, the COVID-19 vaccine became available to all Alaskans, and we were the first state to open up eligibility to all people age 16 and above. So that work continues. And again, you know, this week we had another similar challenge to the adverse reaction with the anaphylaxis at Bartlett. I'm sure everyone saw the Johnson & Johnson news yesterday, and the CDC and FDA's joint announcement to issue a pause for the Johnson & Johnson vaccine. So it was kind of a repeat yesterday of what happened with that first adverse reaction. We quickly pulled together a press conference and involved lots of partners, and got the word out pretty quickly. But it is just remarkable to, you know, we've been working together for so long, you know, both the Unified Command and the Vaccine Task Force, and then all of the public information officers that are part of our group. So it's just, and then the Vaccine Task Force has a lot of ways to get the word out to vaccine providers and also to Alaska healthcare providers. So we were able to get the word out really quickly that the pause was happening, and to get the information out both to the public and to healthcare providers so that they had the information that they needed, and that any vaccine clinics, you know, were immediately had the information that they needed to not issue Johnson & Johnson yesterday. So that's all I really wanted to say on that. Just, you know, it's been a constant balance of managing supply and demand, and the work continues to earn trust from the Alaska public and to build vaccine confidence. And, you know, a lot of that is just really roll up your sleeves and, you know, work by many hundreds, if not thousands of people, just talking one-on-one to other Alaskans and working within their communities to really make sure people have the information they need to make a choice for themselves and for their communities. That is all I have on that slide, and we will move on. And there's some questions in the chat box. We'll try to have time at the end to answer those questions. Go ahead, Jeremy.
Well, we'll have to move through these pretty quickly. There were a number of outbreaks in Cordova, in other fishing communities that we just had to respond to very quickly. Another common messaging theme was the extent and enforcement of mandates. We talked about that all the way through. Like every reporter probably asked, what will happen if people don't do this? And so we really return to that, the community specific requirements and how they meshed with our state requirements. Misinformation, a piece of misinformation I believed was that the RNA vaccine was going to modify my DNA. And I heard that early on and I was like, well, I don't want that one. But after researching more and getting more information, we're all susceptible to that type of thing. And then in-state and out-of-state communications, the communicating with people across the borders is difficult, but we had to do that for the numerous travelers coming here for tourism and for work.
Okay, thanks, Jeremy. I think I'm going to go ahead and move on to the next slide so we have time.
Sure.
So, there's obviously just a ton that we've all learned over this past year and a bit. And I think, we're all a bit exhausted, or at least I can speak for myself and say that I am. But, I really am amazed at what an amazing experience it's been and how much there has been to learn. Some of the takeaways for me, I'm not going to read down this list, but I was telling Jeremy that, I wasn't never a big surfer, but I did surf a little bit growing up, and I grew up in California. And I sometimes think of this response like surfing. You're paddling out through these big breakers and you get yourself out to where you're positioned to where you need to be to ride the next wave. And then something happens and you hopefully ride it in successfully without falling off and cutting yourself on a reef. But once you've successfully ridden that wave, you've got to paddle yourself all the way out again to get back out to the breakers. And, hopefully you can have time to sit on the beach and rest a little bit when you're exhausted and watch all the other surfers that are out in the waves. But it's really been like that, where, normally you have more time to write a comms plan and follow it. And in this response, sometimes people would ask me, well, can you share your comms plan with me? And, it was all evolving so quickly that, we did have comms plans, but often they were obsolete by the time that they were written almost. So it's just been this constant wave of preparing, responding, and recovering kind of all at once.
The remaining flexible was key. Elizabeth and I did what our JIC was going to look like diagram at the onset of it, back when the Unified Command was formed. And our actual operating structure looked much different than what we had laid out initially. And that wasn't a bad thing. The event was just much, much larger and much more complicated than we could have anticipated.
Yep. And we'll try to save time for questions, but that low threshold to ask for help. And that was coming to us from leadership too, which was super helpful. Sometimes Director Hedberg or Dr. Zink would say, what do you need to have? How can we help? What do you need? And I also just felt like I could really ask other people, even outside of DHSS, for help when it was needed. And that they, that was a theme early on, that we were all in this together. And it really does feel like that. Anyway, and also just the focus on empathy and compassion and sort of, remembering that from the get-go of sort of how this information is being received by the people that are going through a rough time, was also a good common thread for me.
We were doing regular meetings with communities at 11 o'clock, and that was key to get a back and forth of information. But we also had meetings with just our state communication team. And those meetings were key. We were doing them on a daily basis, and that was really instrumental in our success.
And one thing I would definitely want to have, we were not great at the state at having translated materials early on, but it was really nice to be able to rely on some other entities like the municipality of Anchorage and the CDC that had a lot of translated materials. And moving forward, that just communicating with diverse audiences is something that at DHSS, we really have talked about trying to institutionalize and make sure that we have that set up from the get-go for everything, but especially for emergencies moving forward. And with that, let's move it on to some questions.
All right. Thank you, Jeremy and Elizabeth. That was a great presentation. So we'd like to go ahead and open up the question and answer segment for this section. So you can either unmute your microphone and ask a question or post your question in the chat pod. In the meantime, Elizabeth, you asked participants to post messaging differences at the beginning of the COVID event versus what was said at the end. And there were quite a few comments in there. Due to time constraints, you can look at those when you get time. In the meantime, I think there were a couple of questions out here from Marmiam Grimes to everyone. There are differing opinions in incident management about whether there should be a PIO-JIC representative in a policy group discussions. What that have made a difference in information flow when rolling out those policy updates?
I can take that on if you want, Jeremy.
Sure.
I do think it makes a difference for, and just in general, I think there's better communications when the communications person has a seat at the table whenever possible, when policy decisions are being made, but recognizing that it's not always possible. So Brian, you got your hand raised. You want to say something?
Yeah, real quick. I just wanted to say there's a couple of comments on the timing of announcements from the state and getting it out earlier to the communications team. And I will tell you, we would have liked that as well. There was many times that the unified commanders were hearing what was being announced on those pressers as well. So always, I think it's, an important aspect for communicators to be part of those discussions, because you all are going to help us craft those messages to make the announcements and all. So I think that's a valuable lesson learned. I know a lot of local jurisdictions and my peers across the country had kind of the same thing. There was just a lot going on from executives at all levels of government, and it was moving very, very fast. And it was interesting or dreaded to be there at 6 o'clock every night in the spring to hear what we were doing tomorrow, because sometimes that was happening. Thanks.
I would say though, on that, our governor, Commissioner Crum and Dr. Zink were ever present in those press conferences, and they did a great job of laying out what was expected. So it wasn't that they were just developing policies and punting it. They were really our best spokespeople for months and months and months, and continue to be our best spokespeople. I think that our leadership did a fantastic job, and our operations did a fantastic job, and that made our job as PIOs a little bit easier. Not that it was an easy job, but Edward R. Murrow said we can't make good news out of bad practice, and we had definitely good practice taking place at all levels of leadership and operations.
All right, thank you. Next question comes from Jamie Roberts. Is there messaging about Johnson & Johnson to put out to the general public, especially for those who got the vaccine recently?
Yeah, Jamie, I can send you some things. And we had the press released yesterday, which you probably have, and then it's going to be addressed on the Science Echo at noon, and I have some information I can send to you on that.
And Casey Cook just wants to thank Brian and he wanted to go on the record for that frustration that Brian addressed there. And then Teresa Rosso says kudos to all task force communication to public media outlets, getting and giving factual info, the state Dunleavy administration holding press conferences with Dr. Zink, Adam Crum, the interdepartmental info was very good. It was transparent and it was honest. And she wants to thank everyone and appreciates the tools to help with vaccine confidence using those resources now.
I see a question about communication plans. You know, I think that we're going to have a communications Bible surrounding pandemics after this event that will, you know, reach down to all levels of government and incorporate a lot of lessons learned. So I think, you know, we learned a lot, and we're certainly continuing to learn.
All right, so that concludes this segment. Thank you again, Jeremy and Elizabeth. We are now going to go on to break and come back in about less than 10 minutes.